Science, has two rules. First, there are no sacred truths. All assumptions must be critically examined. Arguments from authority are worthless. Second rule, whatever is inconsistent with facts must be discarded or revised. The obvious is sometimes false. The unexpected is sometimes true. Carl Sagan. In the United States, despite damning revelations about damage done by these policies and the brazen dishonesty of government officials, politicians still seem to be basing their approach to pandemic management on how they think it will play with voters. The problem is that without an honest accounting of these errors, akin to authorities examining a plane crash for lessons learned to avoid future crashes, the lessons of this pandemic will be written by leaders who designed those poor policies. That means that lockdowns, school closures, mask mandates, vaccine mandates, censorship, and panic are still very much in play as part of the official template for future pandemics. Professor Jay Bhattacharya, Stanford School of Medicine, along with Professor Martin Kulldorff, Harvard Medical School. Hi, I'm Frank Speidel, a retired emergency physician and recovering hospital administrator, and welcome to The Doctor Is In. In this program, the intent is not to practice medicine or provide medical advice. With the help of our guests, we hope to provoke respectful, informed discussions of healthcare and to the benefit of our community. On December 4th, 2024, the U.S. House Select Subcommittee on the Coronavirus Pandemic published an after-action review of the COVID pandemic, lessons learned and a path forward. This is a 520-page report, 2 years in the making. Through letters, interviews, depositions, hearings, and reviewing more than 1 million document pages, the Select Committee sought to collectively take a look back on the pandemic and see what we can do better next time. The minority members produced a 57-page dissenting report. The majority and minority reports agree on the following. The possibility of COVID-19 emerged from a laboratory or a research mishap is not a conspiracy theory. 2, the EcoHealth Alliance and Dr. Peter Danzig should never again receive taxpayer funds. 3, scientific messaging must be clear, concise, evidence-supported, and delivered by a trusted messengers such as frontline physicians. 4, public health officials must work to regain America's trust. America wants to be educated, not indoctrinated. 5, former New York Governor Andrew Cuomo participated in medical malpractice and publicly covered up the total number of nursing home fatalities in New York. I invite viewers to read both reports and form their own conclusions. In a hearing on April 16, 2024, Academic Malpractice, examining the relationship between scientific journals, the government, and peer review, the Select Committee Chair, Dr. Wenstrup, spoke to the value of bringing an open mind, free from the bias of politics and science. Labeling views with which we disagree as conspiracy therapists, this has been done often. The Lancet letter of February 2020 is often cited, speaks to marginal science and scientists. The observations of Select Subcommittee are riveting, worth the read, and sadly sound familiar. Someone who has, from 2020, voiced more similar observations is Dr. Beth Rosica. Welcome back, Dr. Rosica. Take a victory lap. What did I get wrong?
I don't think you got anything wrong, Frank, but sadly I'm not taking a victory lap because this is nothing that I would have chosen to be right about.
Well, one of the great things in science is we generate theories. We make models of how things behave under certain circumstances. We generate these models and then we let the clock start and we see what happens over time. What does the electron do starting at t equals 0 to t equals 20 seconds? The value of our predictions is validated, gets its worth if it behaves the way we predicted it would. Beth Ann, Dr. Rosica, you have been saying some of these things since 2020. So I think you should at least acknowledge that you have been validated by this.
Well, I will say that I do feel a bit vindicated for the report that came out, as you mentioned, the over 500-page report that was very comprehensive. I mean, I looked at, they had 100 investigative letters, they conducted 38 interviews, they did 25 hearings, they reviewed more than 1 million pages of documents. I mean, that is a very comprehensive report. I'm sad that it took 4 years after the start of the pandemic to get to that point, but I do appreciate their thoroughness and the comprehensive nature of the report. And it very much showed that most of what we predicted and believed was accurate and correct.
From start to finish. I didn't find, well, let me amplify what you said. I was thoroughly impressed with, they made statements that were kind of bold. The statements about the governor of New York were very bold, but they documented it. They documented it with emails, with depositions, with statements, with hearings. They showed you where this came from. This was not picked out of a tree.
No.
This was documented extensively. Some of the things were almost entertaining. If you remember, Dr. Fauci was accused of funding gain-of-function research in China through Danzig's Eco-Health Alliance. He had sent money to him, who then sent it over to Wuhan, and allegedly that funded some of the gain-of-function research. There was great controversy about the gain-of-function research. Sadly, in the rebuttal piece, I found it entertaining. The rebuttal piece that was only, 55 pages long, it was a minimal rebuttal, basically said, well, it all depends on how you define gain-of-function. You can define it the way some people do, which is the common English usage of gain-of-function, or you can look to these other sites, which were a 2017 Department of Health and Human Services update that had a very tangential expression for it, but it never defined gain of function. The only time in that document the word gain of function is in a footnote to another article. It was kind of like listening to that sad time when President Clinton argued, well, it depends on the meaning of what the word is. Right. The meaning of the word is. It's one of those, you've got to be kidding me, we're trying to do something serious. What is gain of function? And we end up talking tangentially. We still have that, is still abounding, it seems. Were there any surprises in the report for you?
Honestly, Frank, there were no surprises for me. Most of what was written there was what I thought happened. I mean, I could talk about the school piece in a minute, but I mean, it's ironic because I remember when the virus, first happened, and my husband started saying, I think it escaped from a lab in China. And I'm like, please don't say that out loud. Don't post that on social media. People will, come after us if you utter those words out loud, which people did. People, if you said those words that you think that the virus leaked from a lab in China, I mean, people thought you were crazy. They labeled you a QAnon conspiracy theorist. And here this report sets forth that, yes, in fact, the virus came from a lab in Wuhan, China. So it just goes to show you the things that people believe at a certain point in time, how different and what the real story is. So no, none of that was surprising to me. The gross mismanagement of COVID relief funds, again, not a surprise to me at all. We saw it here in Chester County, buying COVID kits that didn't even work to test people. I mean, but from real fraud, I mean, you want to talk about fraud and abuse, the billions of dollars that were spent supposedly to help people that either were not sent to help people or sent for nefarious reasons or just wasted. So there's, again, no surprises to me. I was appreciative that they talked about the lack of acknowledgement for natural immunity to the virus. Because again, this was such a huge conversation that why would people get vaccines if they've already had COVID because they already have the antibodies? And everybody poo-pooed that idea. The scientific, the Dr. Fauci and others in charge basically said that, no, you still need to get, 15 booster shots to stay safe. So again, none of those were surprising to me. I think what I was most appreciative about the report was, as you said, the comprehensive nature of it, but the detail to which they documented things. So one of the things that I was very concerned about throughout the entire school closure process was the collusion between the teachers union, the American Federation of Teachers, and the White House and the CDC. And we knew all of these things were going on, and RTK's Right to Knows started coming out to produce just the high level of influence that the teachers union had on school reopening guidance. Now, think about that for a moment. To any rational, normal person, a labor union, and a politically motivated labor union, a labor union that gives millions and millions of dollars to 98% Democratic candidates who supported Joe Biden, who endorsed Kamala Harris, who have supported primarily Democratic candidates up and down the spectrum. This politically motivated labor union had the single greatest influence on school reopening guidance than any other entity in this country. That is profound to me. And the text messages that they had between Randy Weingarten, the head of the American Federation of Teachers, to people in the CDC, emails between them, the information going back and forth to the White House, being included in meetings. I mean, these aren't doctors. These aren't epidemiologists. These aren't medical professionals. These are union activists. And they are the ones that drove when schools could open and when they didn't. And to me, that is I'm not surprised by the revelation, but I was pleased by the amount of detail that it went into to expose these folks for who they are and to hopefully enlighten and educate people about the type of influence that these groups have.
Again, it contributes to the the deep, extensive malaise that we have with institutions that we fund to make our world better that seem to be failing us. Education, the healthcare industry, the healthcare professionals. One of the things that I was stunned at was in doing this paper, they provided documentation extensively, quotes all over the place. The ability of people that had been on the evening news on a regular basis, name names, Dr. Fauci, Dr. Francis Collins, orchestrated responses, prompted the writing of articles such as the conspiracy theory article in Lancet, also the primal origin article that appeared in Nature was orchestrated to shut down the idea of a lab leak.
Right.
The exact opposite of the open-minded, apolitical approach to trying to understand what's happening. I found it fascinating to see the hand-waving on some of the depositions or interviews. There was one part where Dr. Redmond, the head of the CDC at that time, who thought that this was a lab leak from start to finish and came out and said that, was excluded from many of these from much of the participation in this because his thoughts weren't correct.
Right.
This is the road to hell. This is the road to bad things. Going forward, again, what can we do? What can Could we make this required reading? I'd like to, a seminar somewhere where you read the majority opinion and you read the minority opinion, and you could do a course on formal logic on this. Critical thinking.
I mean, if we could get people to actually do that, Frank, that would be phenomenal. First of all, most people aren't going to take the time to read the 550-page report. It's very long and very detailed, much less.
I didn't read the whole thing.
No, right. And I did. And to be fair, I didn't either. I read a lot of it, but I didn't read the whole thing. It's a very long piece. But it is important. And I think that's why talking about it, writing about it, I wrote an article in Broad and Liberty about some of the findings, particularly related to the school closures. But I think for me, the key takeaway from this report was the political motivation of the people involved, that this was never about saving lives. This was never about keeping people safe. This was about control and control of information. I mean, I'm thrilled to see that Dr. J will be, going to Washington, after the inauguration, because what a poetic justice for him, a man that was basically canceled, a physician canceled for suggesting that there are different ways to handle this virus, and basically shut up, couldn't practice, couldn't speak, couldn't talk about what was going on.
And Martin Kulldorff, he got COVID early on, had natural immunity to it. Guy's an epidemiologist, Harvard. People in the Harvard School of Medicine were writing articles, writing letters saying, shut this guy up, put him down. When he was saying, hold it, we're doing this backwards. This is a disease that hurts the eldest.
Right.
Keep the schools open.
Right.
Keep businesses open. So the idea was to shut him up, censorship. He eventually was fired from Harvard.
Yes, he was.
Because he would not get immunized, because he already had natural immunity.
Right.
And
well, and that was one of the other things that they talked about, that the vaccine mandates were not supported by science or by evidence. And I mean, we've seen so many people. I mean, that's a very good example, but there are examples all over the country of people who were fired from their jobs for not getting the vaccine. And then there are people who were coerced into getting the vaccine for fear of losing their jobs. So the way that this was handled was just abominable. I mean, it was such an epic public health fail on every single level. And the White House was involved, the CDC was involved, Fauci was at the ringleader of all of this. And, you started the show talking about, his role in this virus leak, and why there was such an intense need to cover it up. Of course he wanted to cover that up because he did not want to be exposed for what he did. And it seems even more plausible that he is responsible for this because the White House is, discussing pardoning him for crimes for which he hasn't even been charged with yet. So clearly, there is, again, political motivation for what he did and for what others did in terms of their response to this virus. And it, again, had nothing to do with keeping people safe.
Why, politics might be one reason why people would see things differently and present things differently. Maybe there's a political gain for them. I've seen this firsthand where people fancy a political career and they will squash people that want to talk about this. Given that, people still talk. You're talking. These people are talking about it. When people do talk about it, what have they missed? Is there anything besides the politics that drives them? Is there?
No. Well, I think financial compensation is also another big piece of this. Fauci benefited financially from pushing the vaccine. He benefited financially in a number of different ways, and I think that other people did. I mean, look at all the pharmaceutical companies. Look at Pfizer and Moderna. These companies profited hand over fist. And then doctors' offices were incentivized for the number of COVID shots that they gave out. So it was a big money-making scheme. Really, that's really what it comes down to, at the expense of innocent, uninformed people. And that is why I say that this was an epic public health fail. No wonder people were afraid to get the vaccine, because you didn't trust the messaging that was coming out.
Yes.
That, Fauci from the beginning said, nobody needs to wear a mask. Masks don't work. And then 3 weeks, everybody's got to wear a mask. Use your socks and make homemade masks.
There's a great picture of Dr. Fauci wearing 2 masks.
Yes.
That's a classic.
Yes.
Somebody said one time that the sign of a truly searing intellect was the ability to simultaneously hold 2 conflicting ideas at once and be perfectly comfortable with it.
Well, that's just like, think about, was it the governor of California? I don't remember. We saw a number of elected officials who were locking down their state, closing restaurants, closing hair salons, and yet they're dining out privately, without anybody knowing. So do as I say, not as I do. We saw that time and time again during these measures.
There's an expression, my body, my choice. Does that just apply to one organ system, or can it be your immune system too?
I agree wholeheartedly with that. I wrote about that throughout the process, that, many people are pro-abortion and they think a woman should be able to do with her body what she wanted. But those same people thought that you were selfish and irresponsible if you didn't get a vaccine that you didn't want, and they were happy to force those vaccine mandates on everybody.
Very, very bright people who can hold 2 contradictory ideas simultaneously.
Indeed.
Were there any surprises in things that weren't mentioned in the report? Was there areas that you thought deserve to at least get some comment? I have one, but let me do it.
Go ahead, you go first, Frank, because there's not. I thought that the pieces for me of most interest was the school pieces, because that's where I spent most of my time. All of the other stuff I still thought was very interesting, but part of what concerns me with this whole report is that, and I appreciate that they want to prevent these things from happening again, which is good. That's an important piece. But I also think holding people accountable for what I think borders on criminal behavior is also equally important. And I didn't see, and that wasn't the intent of the report, but I would have liked some recommendations around consequences for people that acted inappropriately, including the head of the teachers union. I mean, there should be sanctions there. There should be some consequences for her actions that they were able to prove.
I completely agree. I think that there should at least be some, if nothing, the only recognition may be somebody coming out and say, you hurt kids.
Yep.
And that's not the kind of person that should be running a teachers union. You touched on one of my neglected, we can do better, we must do better topics. That maybe it was mentioned, but I missed it. The media. You mentioned journalism. To me, journalism is getting the story correct, getting the story out there, correcting the story if you get it wrong. During the pandemic, it was made massively worse by the approach to, if it bleeds, it leads. We have more frightening news for you tonight. I was stunned, not just that people made mistakes, but that if you, and I've done this, if you take the time to write a letter to the local station where you know the people, the media, and say, on this show, you said this, this, and this. And that's not true.
Right.
And the scare stories that were coming out about it, it was hard to watch from the very start, where you had people doing things like aerosolizing Clorox in confined spaces because the virus is in the air.
Right.
This was getting press. children are super spreaders.
Right.
These shocking things. And when you called attention, there was no, gee, we got to do better. We're sorry about this. There was nobody coming on saying, that show we had last night about children are super spreaders, we got that wrong. Children are extremely unlikely to be the driver of the transmission. Right. You didn't see that, and well,
there was a piece in there about the White House colluding with groups like Facebook and Twitter.
Absolutely.
There was some discussion about their attempts to influence the algorithms of what was, being shown on those platforms. So I think that they did address that partially, but I do think that would have been another good topic to dive into more deeply about the stories that the national papers, chose to run. Thankfully, I think that issue is being exposed more and more and more. The Washington Post, the New York Times, the LA Times, really coming under a lot of criticism of late for their very, very one-sided reporting that I really think has been headed down that road for a number of years. But I think over the pandemic, it completely exacerbated, and it became groupthink mentality across the board. And I think we're now seeing the results of that. And readership is down on all of those platforms. I personally read the Free Press, which is a very balanced, both sides of the article, true journalism. And I think that more and more people are saying, I've had enough with this very biased way that these papers operate.
Well, as long as there's voices like yours, Dr. Rosica, out there raising and questioning with a smile and with fact and with wit, we are going in a better direction. Thank you again for being a guest. And for you out there who have watched this episode of The Doctor Is In, thank you very much for your time, and stay safe.